Botox injections, 50 units in between brows. I had a consultation with a doctor for Botox injections in between the brows. I think I mostly have a 1, not an 11. See photo. She recommends 50 units. Isn't this way too much? I did purchase a Groupon. I'm thinking maybe she just wants more money. Please advise. Thank you.
Thank you for your question. You submitted a photo and you stated in your question that you visited a doctor using a Groupon, and the doctor and your question was to the physician that you want to improve what you describe as a number 1 as opposed to number 11. But basically you want to improve the area between the brows. And the doctor recommended 50 units of Botox. And you're questioning, is that too high? Is the doctor trying to make more money? And again, you did mention that you got this through a Groupon. Well, I can certainly give you some ideas of how this area is handled, Groupon or not. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I and my colleagues in my specialty were amongst the first doctors to use Botox, and so I've been using Botox for patients since 1993. So the first understanding what is the concept of Botox, and Botox is what's called a neurotoxin. But there are other neurotoxins in the same category, Dysport and Xeomin. So when it comes to the number of units, you may want to be specific on whether or not it was Botox, which unfortunately Botox is kind of used generically like Kleenex. It might be that your doctor was suggesting Dysport. As far as the glabella is concerned, generally this area is 50 units is not a typical starting dose. I think that one thing that is very important to establish for yourself is choosing a doctor who you can have a long-term relationship with when it comes to considering Botox. People will often quote, try Botox and do it in these different discounted ways, but I think that a lot of people end up being very disappointed by the experience. If you are going to have a long-term relationship with a physician, I really doubt that you're going to get the best doctor for you by virtue of a discounted method. I think that given that Botox is the number 1 non-surgical cosmetic procedure, or the application of Botox as a procedure, the Botox as a product, this strategy may not be ideal for you. So just the science, again, we're talking about the glabella, which there's 2 sets of muscles there. They're called the corrugator and procerus muscles. Those are the muscles that contract, that cause that line to form. Now, if that line is always there, even when you are relaxed, well, then that line is also a static line. So it's very important that you understand that this line may not significantly improve with the first treatment of Botox. I always tell patients that the skin is like folding paper or creasing a shirt. And so if you iron a shirt and then you crease it over and over, well, those creases will stay. The same thing. With Botox, what's different is that when you relax the muscle, the body forms collagen at the deeper levels of the skin so that the lines improve, but they improve with time. So clearly there's a need for better communication. I was referring to the other injectable neuromodulators such as Dysport, where the units are different than Botox. So you have to be sure that you are speaking specifically of Botox versus Dysport. Typically, I would not exceed like 25 units for the glabella, especially for someone who's getting it done for the first time. It's my approach in my practice to be conservative with the first treatment, and routinely I'll see patients after 2 weeks to reevaluate. If they need more, well, with Botox you can add more, but if you do too much, you can't undo it. So I feel like a stepwise or a ladder approach to dosing so that the patient gets the outcome at the right dose that gives them the best value for the longest period of time, that requires some work, and it requires having someone come in more than just for that one transaction. So I think that you need to get another opinion, or at least at a minimum contact the doctor, get the specifics, ask why that doctor wants to do the 50 units. This is a field that I find remarkable, where how much miscommunication occurs or lack of communication. I make it a point to spend a lot of time with my patients, and I'll take their photos and show them on the screen what I see, and have them see it, see their pictures and evaluate, so that we're both on the same page and we have a good understanding. So again, if you're speaking about Botox, 50 units does seem like a lot. Contact the doctor to get some clarity as to whether it's Botox, Dysport, or any other product, and ask about what will the follow-up be like after you get this treatment. Once you have to find a doctor that you'll be comfortable with, and I think that price is probably the least effective way of finding the right doctor for you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.